Hello, and welcome to Dermatology Weekly, the official podcast of MDedge Dermatology, where we discuss issues that most affect the specialty. I'm MDedge editor Elizabeth Mishkati. And now, your host for this week's Peer-to-Peer, Dr. Vincent DeLeo.
Today, we're talking to Dr. Jules Lipoff about skin type diversity in dermatology educational photographs. Dr. Lipoff is from the University of Pennsylvania in Philadelphia. Thank you so much for joining us today, Dr. Lipoff.
Thank you for having me. It's always a pleasure to talk about my work, and I'm honored to be invited.
All righty, so let's get started. You recently evaluated representation of darker skin types in photographs from the American Academy of Dermatology's basic dermatology curriculum. Can you tell us what you found?
Yes, so this study was in some ways a replication and extension of some previous work that we'd done. This past year, we did an analysis of representation of skin type in different dermatology textbooks and compared that to how it had been 13 years prior in a similar study. And we had found in that study that there was no particular difference over the course of time, and that there was generally poor representation of the darker skin types. And by darker skin types, I mean type 5 and 6 Fitzpatrick, to the extent we agree on what that is. And we also found that there was overrepresentation in certain pigmentary diseases being represented, and also sexually transmitted diseases. So we wanted to see, even though that was interesting, textbooks are becoming more and more perhaps an educational tool of the past, and the more forward way is using more online and visual materials. And we wanted to see if this translated, if we saw the same thing in the American Academy of Dermatology's online educational modules, which is extensively used, especially in places where there is no home dermatology program. And so we, using a few different independent observers, medical students working with me, we evaluated the different images in all these different modules and found, yes, it's basically the same pattern, that there really is generally low representation in the curricular images. And we are seeing an overrepresentation, again, of darker skin types in things like sexually transmitted infections. And that's particularly troubling because it can reinforce negative and incorrect stereotypes, for instance, that suggest that Black people might be more prone to things like syphilis or HIV, or that they are more sexually active or not responsible or something like that. And we want to make sure that there's no subtle or nuanced impression that's going across in all of this.
Great. Now, in your analysis, you noted that darker skin types were poorly represented in skin cancer photographs. What impact does that have on patient care in the population with darker skins?
So we certainly know that skin cancer is much less common in darker skin types. But that may make it all the more important that we're familiar with it and aware of it. We know that when, for instance, melanoma is detected in people with darker skin, it is detected at a later stage, and that their prognosis is much worse. So sometimes when we think about how we represent diseases, should the number of photographs and percentage and distribution represent the population? Or maybe we need to actually overrepresent the minorities and the other skin types that we might not see, because we're trying to teach us to be able to see things in all skin types, to always be prepared and always be able to think about these different diseases and possibilities. So there could be a real impact. And we're even seeing that my colleague, Dr. Ade Adamson, has written about how in artificial intelligence models, we also need to oversample these darker skin types, because the artificial intelligence and machine learning models may unfortunately have biases that make us also not consider that possibility.
So you pointed out earlier that you found in darker skin types that sexually transmitted diseases were more represented than lighter skin types. But some of the common conditions, like acne, for instance, which are very common in darker skin types, aren't represented. What do you think that impact would be on learning about diseases like acne?
So I think like a lot of these diseases, not only can they present slightly differently, there can be different burdens. For instance, with acne, post-inflammatory hyperpigmentation is a much greater issue in the darker skin type populations. We also, I think, another point I'd want to bring up is that the Fitzpatrick skin type system is pretty flawed to start with. You may or may not be familiar with that. It was started in like 1975, originally just to describe reactivity to phototherapy. And it was originally only 4 skin types. There were different shades of light skin. And then only later was it added to be brown and black for 5 and 6, and then incorporating the sun reactivity. So we have found, and we wrote about this in a recent British Journal editorial, that it's not reliable. It's not really objective. And the reason is we're reinforced by our impressions of what ethnicity is. So if you are asked what someone's skin type is, and they are notably a Black patient, even if they're very light skinned, most people will have a tendency to overestimate the number of Fitzpatrick type that they are. On the same token, like if someone is a white patient and they're a dark-skinned light white patient, you may underestimate. And we want to try to make these skin types more objectively, accurately reflect what people's risks are, whether it is for pigmentation after a procedure, or risks for melanoma and things like that. So I think it's important. There's some biology there to pay attention to, whether someone has pigmentation and that affects the presentation of disease. But we are biased by our impression of ethnicity, and we want to try to separate those out so that we can be delivering the highest quality care.
So, that discussion of Fitzpatrick skin type is very interesting, and I have noted previously that many people in the field are talking more and more about altering that process of determining what a patient's response pigment-wise will be to certain procedures or certain diseases. So it's a very interesting conversation that I think is going on right now. But let's get back to the photographs. Why do you think there's a dearth of photographs, and what are some ways that diversity can be improved in educational photographs to enhance the basic dermatology curriculum?
So I think there are short-term and long-term solutions. In the long term, we really need to make our resources representative of the patients that we take care of. We need to make sure that we are not centering the typical or default patient as white. Like, if you can only have space for one picture of acne, that it doesn't need to be a white patient. There's this presumption that white patients are the norm or the default, and that centers it in a way that could be damaging to all these other patients. Well, we realize that there are certain restrictions in textbooks that sometimes there is only room for one picture. But I think as we expand and become more dependent on online resources, there really is a lot more space and a lot more opportunity to show a diversity. In the short term, though, because a lot of these things take time to implement, there are a number of really great resources, existing books and textbooks that focus on skin of color. I'd like to make a point that dermatologists of color have been working on this topic for decades, and I'm only coming to work on it in the last couple of years, and I want to make sure that I give credit where credit is due, especially to people like Dr. Susan Taylor and the Skin of Color Society. She has a textbook, Taylor and Kelly's Dermatology for Skin of Color, that is excellent. There are other resources, Visual DX, et cetera, that are available right now. So we should be teaching our students and our residents. It shouldn't just be like a skin of color lecture. Skin of color should be through every lecture. We should be showing how everything presents in every skin type. I know you've practiced in New York, for instance. You probably have a lot more experience seeing people of different skin types than maybe some other locations. But for instance, just the other day, I saw a patient with pityriasis rosea who had dark skin. And in some ways, we consider when it's like an inverse pattern and a little more violaceous, that's considered like an atypical presentation. But I've seen that so many times in darker skin types. I don't know that I've really seen that presentation represented in text particularly well. And I've learned that from my experience. It's important that like when you show a picture of psoriasis, we think of it having all this erythema, but we know in darker skin types, that erythema is not so visible. We can't see the vasodilatation so well. So we need to make sure that the lack of redness in a patient with hyperkeratotic plaques on the extensor surfaces and with dark skin, they should still be thinking about psoriasis in their morphology.
I totally agree with you. And being a patch test person, I can tell you that you need to train yourself if you're patch testing darker skins on how to read the patch test, because of exactly what you said about erythema not being as prominent or not being as visual when there's inflammation in the skin. So very interesting comments. So finally, how can dermatologists contribute to improving access to clinical images of skin of color?
Yeah, I think that's a good question. I think everyone has an opportunity to contribute. When you see cases in patients of color, you should take photographs of it. You should contribute them. You should share them. I know that many practices do not see many patients with skin of color, so it can be difficult. But if we can have a greater shared pool of images, that will help everyone. We want to also make sure that the responsibility for promoting and speaking about this issue does not rest entirely on our dermatologists of color. I mean, as a white person myself and having some privilege and power, I want to empower those voices to get their message out, but I also want to be sharing that responsibility and not shifting that on them. There's often an expectation that like dermatologists of color will have skin of color as an interest, which isn't necessarily fair to be pigeonholed that way. Even though they often are, we all as a specialty, especially white dermatologists, need to make a point of learning and educating others through our photographs, sharing photographs at every level, and be humble and admit when we don't know certain things and where we can learn more.
This has been a great discussion about a very important issue in the literature. So do you have any other clues or information you'd like to leave with our listeners?
Well, I think there is a real opportunity. I mentioned this in our British Journal editorial recently, in which it's the whole article is called "Why It's Time to Replace the Fitzpatrick Scale." In this editorial, we make the point that with advancing technology, with machine learning, with objective measures, there may be new ways to make sure that there's balance and equity. For instance, I know that there are companies trying to develop tools that you could put your textbook through an algorithm and it would tell you exactly what your skin type diversity is. And so you could, while you're making the textbook, you would have a check to make sure you are being representative. There's even things like that for authors and screenwriters that can tell them, for instance, how many of the characters are men and women or what their speaking roles are, because there's a tendency to favor and emphasize the male characters. And we want to make sure that our stories are balanced and representative. And we want to make sure that our pictures and our educational tools similarly represent all of our patients. One medical student recently published an editorial in the pediatric dermatology about the importance of Band-Aids and having them in different skin type colors. And it seems like a relatively minor thing, like to have Band-Aids that look like different people's skin. But if you have like a darker Band-Aid, it's no longer telling those darker skinned patients that they aren't the norm. It's nuanced, but it says that they are welcome, that they are normal, that they're being centered. And I think that speaks volumes. And we need not only to be teaching, but to be making sure that we are considering all of our patients valuable and important to study, and not in any subtle or unintentional way suggesting that like skin of color is something extra learned or second tier learning. It should be up at the front like everything else.
Great points. And again, we want to thank you for joining us today.
Thank you. I really appreciate it. It's been a pleasure.
That's it for this week's episode of Dermatology Weekly. The peer-to-peer portion of the show is produced by MDedge editor Melissa Sears and editor Alicia Saunders. All of our podcasts are produced by an MDedge editor, Kathy Scarbeck. I'm MDedge editor Elizabeth Mishkati, and this is Dermatology Weekly.